So I'm sure all of you are aware that nutritional interventions are really a cornerstone of how we go about kind of advising patients really who are across the full continuum of chronic kidney disease. So of course, if we look on the left-hand side of this figure, we think about people who have risk factors for chronic kidney disease, whether it be that they are at an advanced age or they have obesity, diabetes, hypertension. They may be from a racial or ethnic minoritized group that has been shown to have higher risk of kidney disease. These are going to be groups that we will work with them on sort of optimizing control of their diabetes, control of their blood sugars through their diet, through weight loss. We may even consider referring them for a specific weight loss intervention. We also often will make recommendations around limiting sodium intake and also limiting their ingestion of processed foods, which often contain lots of sodium. And we also often make recommendations around increasing physical activity. For people who then progress to actually develop early chronic kidney disease, and certainly who can develop some of those markers, some of those clinical markers of early CKD, including high cholesterol or hyperlipidemia, certainly hyperglycemia and other challenges, we continue to make some of those same recommendations that we would make for people at risk for CKD, but here we might enhance our recommendations to include having them increase their fruit and vegetable intake, reduce their saturated fat intake, and sort of other interventions. And then certainly as people then develop declining glomerular filtration rate or sort of loss of kidney function, they can start to have even more sort of sequelae that may concern us. And so we would begin then to make other recommendations, including around optimizing the amount of fluid that they take in. In some cases, they may have to limit their fluid intake if they're not actually able to excrete all of it, sort of excess fluid. And we continue to make recommendations around their actual dietary pattern. And then, of course, for people with kidney failure, we have a whole other set of recommendations that we make. During our time together today, we're going to focus our attention on these sort of three areas, these really thinking about people who are at risk for chronic kidney disease in the first place, and also thinking about interventions that might be useful for actually helping to slow the decline in kidney function in these populations to hopefully actually prevent their developing kidney failure. And so in this sort of space of nutrition and kidney disease, there's been increasing focus, I would say, over the last decade or so, and in thinking about dietary patterns as opposed to thinking about particular individual nutrients. Many of you who have been in practice for years may recall a lot of the work that emerged really almost 3 decades ago around protein restriction. There's been a bit of a shift now towards thinking about not just particular nutrients, right? So thinking about things like protein, but actually thinking about the whole suite of a person's type of dietary pattern that they follow. And this turns out to be much more consistent with how people or patients actually go about eating than is a focus on individual nutrient intakes. When any of us sits down for a meal, we're not thinking about how much protein I'm taking in, how much potassium, how much sodium, right? We're thinking about really food groups. And this is for those who are particularly who are scholars in this space. The sense is that will by focusing on the overall pattern of how people eat will actually help us to align our recommendations better with the way that people tend to sort of go about their lives when it comes to their dietary practices. And as it turns out, several dietary patterns are actually well established as healthful and preventative of morbidity and mortality kind of in the general population. And there is emerging and sort of increasing work around how these healthy dietary patterns actually have a role in kidney disease and actually helping to prevent kidney disease in the first place and also to help prevent the progression of CKD. And so some of those patterns that have been associated with favorable kidney outcomes include the Mediterranean diet, which I'll share with you kind of an overview of what these dietary patterns include. but also the dietary approaches to stop hypertension or DASH dietary pattern, as well as dietary patterns that are low in dietary acid load. And I'll talk more about what is meant by that, but essentially these are ways of eating that ultimately lead to less acid for the kidneys to handle. And we'll talk in detail about kind of how we go about assessing that. And so when it comes to the Mediterranean diet, many of you have probably heard of it and maybe have had patients who are trying to follow this dietary pattern. It is one that is rich in whole grains, it's rich in fruits, legumes, nuts, and vegetables. It has actually a fair amount of healthy oils like olive oil, with modest amounts of meats and certainly limited amounts of sweets, and with wine in moderation, which is a part that many people like about the Mediterranean diet. But this is a dietary pattern that has been associated with a number of favorable health outcomes, particularly cardiovascular health outcomes. And you probably know that we share, in our favorite disease, in kidney disease, we share some of the same risk factors as do those focused on cardiovascular disease, and therefore some of the same interventions that are helpful for cardiovascular disease are going to be helpful for kidney disease as well. And so in terms of literature around the Mediterranean diet, this study was conducted in Sweden. So this in a population of 1,100 Swedish men who were an average of 70 years old, and about 500 of them had reduced kidney function. So they had an estimated glomerular filtration rate less than 60, about half of that population. And in this study, what they did was to assess the Mediterranean diet scores of these men. And what happens is basically based upon those food groups, there is a sort of a calculator that's been developed that can allow a numeric score to be gleaned that basically summarizes the pattern, the pattern of eating that a person has. And so what they found was that the Mediterranean diet score was lower among those individuals in this population who already had chronic kidney disease than it was for those who did not have chronic kidney disease. Those who did not have CKD actually had a slightly higher Mediterranean diet score. And I think really importantly, in this study, when they went on to then examine survival rates of those men who had CKD, and they sort of separated out the population based upon their Mediterranean diet score, what they found, and this is indicated by that dashed line, what they found was that those who had the lowest level of sort of natural adherence to a Mediterranean type diet had the poorest survival. So they were more likely to die than those people who had who just naturally were following a dietary pattern that was closer to a Mediterranean diet. And I mentioned that they were naturally following it because this was not a randomized controlled trial. This was just the way that these men ate. And based upon that, their risk of mortality was assessed. So turning to the dietary approaches to stop hypertension dietary pattern. So I think it's a small enough crowd, we can do some informal polls, but how many of you have heard of the DASH diet? Everybody? Okay, great. How many of you have heard the DASH diet mentioned in CKD clinic? Fewer, right? Okay. So it's a dietary pattern that's certainly been associated with better health across a number of different indices. So it's definitely been shown to sort of following the DASH diet in clinical trials has actually been shown to lower blood pressure. It's actually more powerful than many of the medications we commonly prescribe. It's actually a really potent way to lower blood pressure. But in some epidemiologic studies, the following a DASH-like dietary pattern has also been associated with a lower risk of developing hypertension in the first place, also a lower risk of developing type 2 diabetes, as well as a lower risk of developing heart disease, as well as stroke. So really, it really is a dietary pattern well studied regarding its health benefits. Through some work of other groups, as well as myself and my colleagues, we've been able to show that following a DASH dietary pattern is also associated with a lower risk of losing kidney function over time.